So with next gen questions, those of you that potentially will be taking it in April of next year or beyond, the thing about next gen is it's only going to be about 20 to 25% of your exam. However, that doesn't sound like a lot, but that means 1 in 4 or 1 in 5 questions will be a next gen question, which is actually quite a bit if you think about it. So anywhere from 75 to 145, every 1 in 4, 1 or 5 questions is going to be next gen. The thing about next gen is the subjects. The good thing about this is, if you notice, and I'm using UWorld because again, they're always up to date versus everyone else. And that's NCSBN or Princeton Review and NCSBN is also always going to be up to date. So I like this because, well, this is what they've given us as well too. The thing about it is, like, if you notice, we've taken out a lot of the critical care, fundamentals, leadership, farm. None of that's really in there. But we look into adult health, child health. Cool. Maternal, huge, right? So adult health, maternal, and then mental health, if you notice, is right up there as well too. But what I want you to know is the topics have now kind of changed a little bit, okay, as far as what we do. So let's do adult health and child health. If you look at it, cardio is still going to be number 1. GI right there. The one that stepped up, if you notice, is HemOnc. HemOnc and respiratory have now become right up there. So if you look at it, it used to be when we did like what we're doing right now, it's like, okay, mental health, GI, which obviously is still there, but they just brought up hematology, oncology, and respiratory right up there. So these are huge. Why did they bring that up? Because check this out. When you do one of these questions, the way that it looks is what? I told you you're going to be looking at a chart. Like, you better know your vital signs. You better know how to read a chart inside out. So let's just do 5. Let's just look at them. We're not going to do the questions, but let's just look at them. Each one of these is going to have 6 questions. So look at this. Let me make this a little bit bigger. So right now, I told you it starts 2023. Yeah, April. So you're fine. What did I tell you? I said, in real life, you got to be able to read a chart. Why do I think I want you to read? Because this is real life now. Now they're trying to see if you can understand exactly what's going on, because at 8:45, this is your chart. This is your notes. This is what you're coming into, your vital signs. And now you've got to look at priority for follow-up. Yeah, this is not easy, right? This is not easy. And then in order to submit, in order to go on to the next one of 6 questions on one chart, you've now got to go on to, you got to get that one before you go on to the next one. Now look, this is where it gets insane. You remember select all that apply? Well, yeah, before you'd be like, oh, this is just DKA, cool. Let me select the stuff that has to do with DKA. Not anymore. Now you got to know the difference between DKA and all the signs and symptoms of all of your differentials. Remember, so when we get into GI, I talk about appendix. This is ironic that this came up because I've been teaching this for a very long time. And when I talk about GI, those of you that have jumped ahead, when I talk about appendicitis, what is the differential diagnosis that I compare it to? I've been doing this for ages. And now they're starting to ask it like that. Compare your differentials now, right? Compare your differentials. I've already taught you, well, appendicitis can present just like a 17-year-old female that has lower right quadrant pain, right? So what are the signs and symptoms we're going to see? Well, now you got to be able to tell me, well, this is appendicitis, well, this is a ectopic pregnancy. You see the difference? So those of you that are thinking about taking it in April or beyond, I think you should highly consider taking it before. So now we have to actually choose which one is going to be which one and then go from there. So that select all that apply is now changed completely. But the good thing is The only good thing about this is that your select all that apply now gives you partial credit. So before, well, right now it's all or none, right? Like you have to get all of them either correct or all of them wrong. But now they're going to give partial credit. Why do they do this? Well, it's the same thing I've taught from day one. Like my method, like this is nothing new to what I've been teaching you. I'm teaching you to be real life nurses. PowerPoint, PowerPoint, PowerPoint. But this is real life. This is real life. When I teach you differentials, well, this is what I'm teaching you. You've got to know in real life what you're dealing with. And again, if you notice, go to my GI lecture right now from from before. And what do I say? If I use a 17-year-old female, this is now that they're starting to show this. I was doing this before, so I want you to think like that. You'll be prepared if you're going into April. Don't worry. I will have you prepared as I will have you prepared for this exam as it is. So now I've got 2 of them done. Now I can go on to the next one. So now I have to determine what's going on here and diagnose it. So now I have to diagnose whatever it is and tell me why I'm diagnosing that. Or like in this situation, this is not diagnostic, this is what they're most risk for. Well, I don't even know what the situation is, but if I'm choosing peritonitis and sepsis based off of what? Well, maybe vital signs, probably abdominal pain, right? I'd probably take that. Or if we were looking at intra-abdominal hemorrhage and hypovolemic shock, maybe vital signs, right? Like you have to, like now it's like, not only are you going to tell me what they're at most risk for, but you got to tell me how you determine what they're at risk for. This is insane. This is intense. It is intense. So now we go on to that. I mean, obviously I didn't read even a bit of it, but I want you to see. Again, now we're looking at expected versus unexpected. Well, guess who's been teaching you those 2 words for a very long time, right? Expected versus unexpected. So now you can tell me what's expected versus what's unexpected. But again, the reason why I teach you all these things, or I've been teaching these things the way that I've been teaching it, is because I teach from an academic purpose, a board purpose, and real life purpose, right? There's a lot to what I do. Like I said, there's a method to my madness, no matter how goofy I look. So, but this is real life now. This is real life, right? You're gonna have to do this. And now we've got 6 questions that are gonna pertain to one chart alone, okay? So now we still have prioritization questions in there. We have select all that apply kind of in a different manner, and also in the same way that we used to take it. But you're going to have to decide now what you're going to do first by highlighting it. So now it's not just 4 answers that you got to choose from. Or oops, not that. I don't even know what the situation is, but I'm probably going to start fluids. I don't know. I mean, that's just kind of the way I look at it, right? Or it maybe even one of these administer the bolus, but whatever it is. But again, you see how I've taught you what are you gonna do first? Well, if it's DKA, if it's what's it called, ectopic or appendicitis, what do we do first? IV fluids, IV fluids, IV fluids, right? So like I'm still teaching all this information, but the way they're gonna ask it is very different, and the way that you're gonna have to read is very different. So next is, again, a typical select all that apply, right? I said there'll be the atypicals where you have the columns, and then now you got your typical select all that apply, right? So whatever it is, you do. So it is as of right now, it is still the 75 to 145. Okay, if I get any other information, you will know. But again, look at this. Let's go back. It's not just nurses' notes that you've got here. You got lab results. So glucose, we would have looked at, we're like, whoa, this person probably got what? Now we look at that, we're like DKA probably, right? Prescriptions, what are they on? Well, this is what we've done for them, right? So again, it's a very different format as far as what we guessed 11 out of it, 11 out of 32 right. I got a 33% just by randomly guessing. But yeah, the cool thing is, again, you do get partial credit. You do get partial credit. But do you see how intense this becomes? So yeah, so as you can see, the next gen, again, imagine 1 out of 4 or 1 out of 5 questions is going to be this. So a couple of things that I bolded in my notes. Understand physical examination and shorthand, right? When you're looking at, so the way that I write to you is considered shorthand. Like when I write, contraindication, or when I talk about multivitamins or NPO, these are all shorthand, right? This is actual chart notes, how they're going to be written. Know those for the next gen. Those are very important in physical examination and chart notes. There will be prioritization, just like first gen, but there'll be prioritization in the form that we saw, where you have actually like 6 or 7 of them as well too. So it's not just going to be 1 out of 4 like we're used to. And then you may have to highlight options throughout the chart note that may be prioritization, or that may be signs and symptoms, or select all that apply. So you may actually get a whole chart note, and then you'll have to choose lines that are signs and symptoms of what may be like DKA. And you have to choose, like, they'll say those 4 signs and symptoms, and they'll allow you to highlight those 4 lines. So yeah, it's definitely the expected versus unexpected for farm, treatment, and education. You will have traditional SATA. The only good thing is that there's less topics to focus on with these, right? Like we said, when we go backwards here to create test. But if you notice, next gen, maternity is a big one, mental health, and then the topics under that. So but yeah, that's just a kind of a little preview. No fundamentals, no farm. Indirectly there will be farm on there, meaning you better know your farm, but they're not going to ask you necessarily a farm question directly. They're going to ask it underneath that. So yeah, so just kind of give you a preview of exactly the longevity of the vignette. Is now, it's not a vignette anymore, it's actually a chart. The chart will have multiple tabs, so you're looking at it as if you were looking at it in real life, and then you're going to have to answer different types of questions. Now, I think the biggest change is the differentials. I think that's huge. I think it's a really big change because it's something that I've taught you. Like when we get into GI, I teach you or even when we get into cardio, I teach you a differential of heart failure versus cardiac tamponade, right?